Abortion. The Abortion Project details. Arguments pro and anti-abortion were written by Reagan King, Shalonka Roney, and Julie Matthews. The PowerPoint was created by Kylan Walser and Sarah West. The extra credit video is presented by Sarah West. Intro. The debate topic that we have chosen is abortion. We have chosen this topic because it is a very current and important discussion for many. In this slideshow, we will present both sides to the argument so that one may consider both viewpoints and come to their own conclusions. The majority viewpoint. Our majority viewpoint for abortion was pro. As women, we stand against people who tell us what we can and cannot do with our bodies. We believe that everyone else can respectfully mind their business and boundaries. The majority includes Reagan King, Shalonka Roney, Julie Matthews, and Kylan Walser. Minority viewpoint. The minority viewpoint was anti-abortion. After careful consideration, this viewpoint was reached with the conviction that the body being harmed is not in fact a woman's, but a baby's, as well as with the belief that any child, through whatever means it was conceived, is innocent and deserves a chance at life, whether that be with its biological mother or an adoptive family. The minority includes Sarah West. Pro-abortion argument. Abortion has always been a topic for discussion among people. In the past years, laws were made to keep women from getting an abortion. Abortion bans have far-reaching consequences that impact access to the full range of reproductive health services. Abortion criminalization exacerbates the surveillance and criminalization of pregnant people. When abortion is criminalized, any pregnancy outcome can become a target of investigation, whether you experience a miscarriage, stillbirth, abortion, or even birth. Imagine having a miscarriage after being so excited to finally conceive a child, or even worse, being raped at gunpoint and becoming pregnant. You can't even terminate the traumatic pregnancy that has caused you PTSD, because some men decided that abortion should be illegal. Women do not want a male advocate, just as men do not want a female advocate. Women should do whatever they want with their bodies, when they want to do it, how they want to do it, and abortion should be at the top of the list for decisions a woman can make for herself. Being a mom is hard, but being a teen mom is harder. When someone is taking away the right I have to decide when I should become a mom, it's even harder. 75% of abortion patients are low income. Nearly 75% of pregnancies among those of us who experience homelessness are unintended. One study found that people without homes become pregnant at twice the national rate. Unintended pregnancy in this circumstance can add immense trauma and stress to an already traumatic experience. Violent attacks on those of us without homes are shockingly common, and pregnancies resulting from sexual assault are devastating. The repeated loss of self-determination is both unforgiving and completely unnecessary, and disempowering people further certainly doesn't help any of us regain stability. Women should decide when they want to become a mom, because when that choice is taken away from them, it's also putting another life into the world, and sometimes the world is unforgiving. Kids should not be born into homelessness. They shouldn't be born with drug addict parents, and they shouldn't be born out of traumatic experiences like rape. Everyone thinks of abortion as killing babies, but maybe we should look at it differently. Abortion has been said to be one of the safest medical procedures out there. According to an article written by Planned Parenthood, abortions are quite similar to getting your wisdom teeth removed. Treatment after abortion consists of penicillin, Tylenol, and ibuprofen. 1 in 4 women have an abortion by the time they're 45 years old. The commonality of abortions allows different organizations to effectively study the safety. Serious complications due to abortion is very rare. Over time, technology has evolved and has allowed abortions to become a lot safer for women. In advocating for abortion rights, it is crucial to consider the principles articulated by Martin Luther King Jr. and Friedrich Nietzsche. The argument that pregnancy is an inherently risky medical condition and individuals should not be compelled to endanger their lives for others aligns with King's emphasis on justice and fairness in his letter from Birmingham jail. Just as King championed the cause of justice and the right to be treated with dignity, this perspective supports a woman's right to make her own decision about her body without being subjected to undue risk. We generally don't ask one human being to give so completely of themselves to another, but we do so when it's a pregnant person. The assertion that abortion is a constitutional right, as highlighted by Deleuze, corresponds with Nietzsche's idea of re-evaluating established moral values in Beyond Good and Evil. Recognizing abortion as a constitutional right challenges traditional norms, reflecting a Nietzschean perspective of questioning and reinterpreting moral perspectives, principles to better align with the evolving needs and values of society. The Texas abortion law prohibits abortions after the fetal heartbeat can be heard. According to an article in the Varghese Somerset, a judge allowed a temporary injunction clarifying what abortions due to medical emergencies are. These emergencies include pregnancies that are unsafe for the mother, among other things. Doctors will face criminal charges if they are found performing abortions in Texas outside of the current medical reasons. A pregnant woman will not be criminally liable for having an abortion. Although the woman will not receive criminal charges for receiving an abortion, any medical personnel caught will be charged with a fine of up to $100,000 imposed. Websites like Planned Parenthood have Texas listed as abortion being completely banned in the state. The biggest argument for anti-abortion should be illegal is because abortion is murder. Factually speaking, it is a true statement. There is no way around what you're doing, and the hard truth is yes, you are killing your baby. There was a movie that came out several years ago about this very topic, called Unplanned. It's based on true events that happened with Abby Johnson, who is the director of a Planned Parenthood clinic in Texas. She encouraged women to not be scared and fearful, that the babies were too young to feel anything during an abortion. One day, she got called into the abortion room where they were performing an abortion, and she witnessed a fetus pulling and fighting the suction wand that was trying to pull the fetus out. Watching this fetus fight, after so many conversations of her telling the people that the fetus couldn't feel anything, changed everything for her. Abortions can also create many long-term health risks that might not be worth it. Some long-term effects are outcomes with your future children such as secondary infertility, stillbirth, preterm birth, and sometimes a low birth rate. Another long-term effect that isn't talked about enough is the mental health that women can go through post-abortion. Women who have abortions report higher rates of mood disorders, depression, bipolar disorder, and dysthymia. The closest state to Texas that has no restriction on abortion is New Mexico. There are no current bans on women traveling out of state for abortions as of now. Out-of-state abortions may not be good for women who cannot make their follow-up appointments. However, some women may not be able to afford travel, leading them to the black market for abortion. The black market can lead to infections and/or death. According to an article on the Planned Parenthood website, the Texas SB 8 law allows people from across the country to sue people they believe help someone perform abortions for someone after 6 weeks. This law may scare people away from black market abortions, but the potential risk is still there. Although abortions have been considered medically safe, according to an article written by PubMed Central, after a study was conducted with 248 women, the study showed that 1/3 of the women who received an abortion have had psychological issues. These issues consist of depression, worrying about future conception, lower self-esteem, nightmares, guilt, and regret. There are cases where women could not bear the guilt and committed suicide. When considering abortion, it is safe to say you should also speak with a psychologist before making the decision. If you are unable to seek professional counseling, you should speak to someone who has been through it and see what they struggle with now that it is done. Taking these extra steps may prepare you for the future aftermath. In opposition to abortion, the argument that adoption provides a viable alternative is grounded in principles akin to Martin Luther King Jr.'s emphasis on compassion and the interconnectedness of humanity in his letter from Birmingham jail. Choosing adoption over abortion aligns with King's call for a sense of community and collective responsibility, fostering a belief that every life has value and potential contributions. Interestingly, the contention that abortion is a form of eugenics is voiced by the niece of Martin Luther King Jr., Alveda King, and Alveda King calls abortion racist, which resonates with Niche's concerns about the reevaluation of moral values and beyond good and evil. The idea that abortion could lead to a slippery slope of trait selection-based procedures and potential harm to vulnerable populations reflects Niche's caution against the unchecked pursuit of certain moral ideologies. This perspective urges a reconsideration of the societal implications of endorsing abortion practices that may inadvertently contribute to eugenic tendencies. Conclusion. During this presentation, we have provided enough information to begin one starting point in forming their own opinion on abortion. Although both sides have conflicting viewpoints, neither is necessarily right or wrong. It is up to each individual to decide their stance on the issue. Thank you.